Hi, and welcome to At Work With, where I sit down with people who lead, build, and figure it out as they go. Because let's be honest, it's never as neat as it looks on LinkedIn. Today, I'm joined by Hilary Evans-Newton, who's been leading Alzheimer's Research UK for the past decade. She's built the organisation into a research powerhouse, all while raising 3 kids, championing women in leadership, and keeping her eyes firmly on one goal: a future free from dementia. We talk purpose, pace, and what it keeps to keep the hope alive when the work you do could change millions of lives. Please join me in welcoming Hilary. So, Hilary, thank you so much for being here, and congratulations on 10 years as CEO. Before we get started, obviously, into the crux of the conversation, what I'd love to start with is just to understand how you've ended up in the third sector, with starting obviously in public policy and public affairs. How did you end up in health and aging?
Yeah. So I guess my first sort of experience of health charities was when I worked in consultancy. So I was doing public affairs consulting, and we had some pro bono clients across the company, and a number of them were in the kind of patient led organizations and groups. And I was probably more interested in those clients than I was the paying clients. So I think that probably showed me that that was certainly a sector in terms of voluntary sector that I was interested in. But I think then the opportunity to be advocating and improving people's lives from a health perspective, I think has probably been something that, from a sort of personal angle, but professional angle, was just a real sort of pull for me. So getting then a job in what was age concern at the time just felt sort of my sort of natural home.
And when we go to the personal side, you've spoken obviously about your grandparents and their experience with dementia and how you saw that. How did that how did that shape kind of your mission into continuing in this field? Because what I find a lot in the third sector, people bounce around, right? They go into health and then education and then something else. So, you've stayed in the same, I'd say,
Yeah.
industry almost.
Yeah, I have. Yeah, I think I guess probably almost without sort of knowing it, the experiences I had in helping support and care for my grandparents as a teenager had shaped actually the experiences of that older people often face. So, they were luckily enough all to just about get into their 80s, but all needed various levels of care and support, from the sort of end days of being able to live at home to the early days with different forms of dementia, but Alzheimer's
Mhm.
disease for my father's dad initially. Um, and I think that the the sense that there's sort of no one giving them a voice or sort of supporting them. And I spent quite a bit of time with my grandparents and had huge respect for them, and I think that, sort of seeing the person that was there and the granddad that I knew ebb away with this condition,
Mhm.
and my parents then having to lean in and support and find care and do all of the things that so many families have to do, probably did give me at quite an early age this sort of personal perspective that
Mhm.
actually things shouldn't be like this. And that sort of stayed with me, and I think, yeah, and I think that then is probably sort of strengthened as I sort of went through my 20s. But I think there was always a sense from me, and actually the kind of person that my granddad was as well, was to be able to give a voice to those who didn't have a voice and to advocate and to want to change something. So I probably am someone who sort of sees myself as someone who's kind of, well, if I can do something about it, I'll try and fix it. And I might be doing that. That might be something that's broken at home, or it's like, my bit of trying to change the world, and a sense that, that I should, yeah,
Mhm.
use the chance that I've got to be able to do that. And so getting a role with an age concern, gave me the opportunity to do that and to work across all areas of public policy that affected older people, but probably health and social care were the sort of area I spent more time on and have gravitated towards.
Oh, it's wonderful. And I really feel like when you come into a job like this with lived experience, I think that the value that you can offer, not just to like the business or the charity, but just to the outcomes
Mm,
is incredible.
mm.
And we'll go more into, but before that, and I know we spoke about this earlier as well, you're also a parent, which I find incredible. I'm also a parent, but you've got three, which is incredible. What's your what's the reality of being able to balance a role like this? You know what, it's not even a balance. How do you juggle it? How
Yeah,
do you
I'm
do
gonna
it?
say balance is probably not
How do you
something
make
I
it
find
work?
I have a lot of. So I think, yeah, so I have 3 children. I have an 8-year-old, a 5-year-old, and a 3-year-old.
Wow.
So pretty much from the start of being a chief exec, um, I have, yeah, been pregnant and had small children. And so I guess in a way, I don't know anything different.
Yeah.
So,
Yeah.
I've always had this role with a young family, and I've had to make it work, and it sometimes it hasn't felt like it's worked, and it's been really tough. Um, but I guess, I often sort of remind myself of what I'm trying to do and what sort of an example that gives to the children. And I think that they have also been very used to, mummy and daddy working full time. And that's a juggle between us. If I've got a
Listen.
lot on and I'm away a lot, then, I have my partner and family that step in. So I do have quite a bit of support. And I couldn't do that without parents who, my parents, they're now in their 80s, but they moved from Somerset to near Cambridge to be near us just before I had my first son. So I think that, I'm lucky in that I do have some family support. Um, that makes a big, big difference. But I think that it's also, for me, I guess, in the sector and as a leader, probably 10 years ago, there weren't as many kind of young women. I mean, I was in my mid-30s when I became a chief exec. There weren't that many people that were in that boat. There were people who had older children who had then become a chief exec when their children were much older. And actually, there was one or two of them were like, "Oh, it must be really hard for you. I couldn't have done this when my children were." I think, okay, that's not what I did. That's great here. um, but there've been some who, and leaders who I've worked with from different sectors who have completely smashed it and have been real inspiration, and have sort of said, actually, for a while it will seem really tough and you kind of need to throw everything at it. And, childcare will be really expensive and you'll feel that you're just kind of just pedaling through a few years, but actually you'll sort of break through and things will become easier and things will become different. And I think that's true. And I think as long as you sort of don't have the sort of expectations of what this will look like, and being able to
Mhm.
do everything all the time. You just can't. I can't be at every school performance. I can't be at the school gates all the time, and I'm not. And sometimes that's tough in that, well, mummy, why don't you do this like some of the other parents? Or and actually, as soon as I explain it, that's, oh, okay. Okay, so that's sort of how it is. But then I try and I do try and balance it. I always try and pick them up on a Friday afternoon. I'll pick them up at normal time, and I guard that time quite sacredly. I try and work longer hours kind of when school term time, take a bit more holiday when they're off. So, I do try and do that. And I'm quite good, I think, it's sort of closing off and saying, actually, this is time where the children need me. And there's different points where, they're a bit wobbly starting school or changing something. And actually, I do just need to be around a bit more. And I've also got a brilliant team here. And we flex things between us. We've all got different challenging circumstances at work, and actually are very open and honest about those challenges. And I think that culture within this organization has made a real shift. And I think we've always been flexible and open to how we work kind of long before the pandemic,
Mhm.
that being a sort of more of a normal way of working. So I hope that also sort of sets an example in terms of what I would expect for other people, which isn't to always work in the way that I have. And, I didn't take very long for maternity leave, and I always say, don't follow, what I did. That doesn't mean it works for everyone. I'm also in a privileged position where, as chief exec, I could bring the baby with me. I often would come in and do board meetings, and I had them very little in a sling. But actually, when they're really little and they sleep quite a lot, that was okay. Not so much when they became toddlers, and then you haven't got that
Yeah.
flexibility. But
Chaos. But it's almost like mid-30s, you become a chief exec, you've got little kids. You're like a trailblazer for so many women who at that time would never think that, oh, this could be a role for me, or I could find some sort of juggle. And like you said, everyone's struggle is unique depending on your situation. I'd love for you just to talk me through bringing your which baby was it? Baby number 1 to the dementia conference.
Yeah.
I would love to hear that story. I read it briefly in the Financial Times. But if you could
Yeah.
just talk us through that story, I would love to hear that.
I mean, that was that. Yeah. So this was when my son was 10 weeks old. And there's a big
Mm.
international conference in Alzheimer's disease, and it moves between sort of North America and Europe each year. So it's probably in London once every sort of 10, 15 years. It was in London, so I thought, great, I can come to the meeting. I'll just come down for the day, see some of my team, catch up with some of the international partners that we have. Really nice opportunity. Didn't think twice to bring a 10-week-old baby in a carrier. But then with, the buggy and all the things that you need with a 10-week-old. And so, I kind of rock up, come into the conference, go to our exhibition stand. And then I had coffee with an American colleague. So I thought, oh, I'll leave the buggy behind the stand with my team. Anyway, go and have this meeting, come back to the stand. And my team said, oh, Hilary, we're really sorry, but the security card has confiscated your buggy. Sorry? And it was behind the stand. I thought, it was like, it's a fire risk. Why is it? And so, oh, no under 18s allowed in the conference. Okay. And anyway, so then I was with this American colleague who's been a real trailblazer in terms of being a kind of a working parent herself. Who then between us, we're then like, okay, we'll need to get the buggy back. I literally just had baby in a sling, nothing else with me. Like nappy bags, all the things you need.
Oh,
Anyway, so we go to try and find security, and then they escort me out of the building. And said, well, we've been told by the conference organisers there's no children allowed. And I said, it's 10 weeks old.
it's
People wouldn't even
hardly
notice that he's here.
qualifies. Yeah.
Can I have my pushchair back, please? And so in the end, they wouldn't let me back in even to go and get the pushchair, made me stand at the entrance. By which time I'd kind of amalgamated a whole group of mainly women, but there's a few men and a few other parents there, essentially all kind of trying to help me and making phone calls to the conference organisers. And a friend of mine who worked for a big pharmaceutical company who were a sponsor of the conference essentially phoned them up and said, I'm going to pull your sponsorship. We need a new mum's room. We need access for people who've got babies. And so sort of between us, we managed to allow my baby to have access to the conference as long as I didn't take him in the auditorium, which I wasn't actually planning on doing. And then for future years, we then got the conference organisers, and they still do now, to have a nursing room for new parents. They have a creche, they have some childcare. But it was one of those where, like, at the time, I didn't feel that was, as a new mum, you kind of think, oh, I'm sort of holding it together. I've got a 10-week-old. I'm kind of coming back. I'm seeing some of my colleagues. It's going to be kind of a nice day. And actually you come away thinking, gosh, this is really tough. I kind of thought, this is 2017. I sort of thought things had changed and actually I'd be able to do this. And actually probably if that happened now, it would probably be a bigger story than it maybe was.
Yeah.
But I hope that's then changed. And I had, particularly some American colleagues coming up saying, well, actually, I brought my even smaller baby because they're back at work with a 6-week-old, and my husband's in the cafe over there, and I keep having to leave so I can go and breastfeed my baby. And I was like, this is crazy. What are we trying to do? We're trying to encourage women into neuroscience and continue to be able to work. And so yeah, that was an early lesson in the still challenges, but hopefully I've made a bit of difference for others attending those conferences.
Have you been back to the conference since?
I have, yeah. I haven't used it actually because they've generally always been in America, and the idea of taking one or any of my children on a long flight to a work conference isn't particularly appealing. But I think that, what you do need is, and particularly for international audiences and people who are traveling, and if you have got a baby you're still feeding and the child you want to bring with you, you need to have some kind of facilities to support
Yeah,
people.
absolutely.
So yeah.
Oh, that's amazing. If I ever somehow end up in these conferences, I will go and check it out. I'll be like, I know
there's
who
been a few
started this.
instances. I think there was a tech conference only maybe a year or two ago. It was on the front page of the Times. And there was
Yeah.
there was a new mum in a very similar circumstance who sort of was coming back in whilst on mat leave to do like a keeping in touch day, and was told, this is a tech conference, you can't have children here. And so,
God.
unfortunately, it does still happen. But I think it was good
Right.
for me in terms of actually, bringing, and each of them I've come in when they've been quite little to key meetings, either externally or internally, and sort of showing to others actually that it is important to be able to keep in touch if you want to, but at the same time
Hmm.
also take 12 months off and don't
Yeah.
worry about work. But actually, if you want to keep in touch, or you want to be able to come in, or you want to come and just see, actually this is a welcoming place to come and do that.
Yeah. And you should be able to bring your whole self, right? Like they say, to
Exactly.
work,
Yeah.
with
Yeah.
whatever,
Yeah.
flavor of life you're in at that time.
Yeah.
So,
Yeah.
oh, I love that story. I was like, literally, I think I reread it like a couple of times. Like, this is great. I have to know more about this. So you obviously you joined more than 10 years ago because you joined,
I joined as a
2013.
director. Yeah.
You joined as a director. But when you made the transition, into AI UK, what did you imagine at that time that it could become? When I read about the background, it was a much smaller organization from where you'd come
Yeah.
from. It
Yeah.
was not what it is now.
Yeah.
So how was that transition?
Yeah, so I think I'd been at Age Concern that then had gone through a merger with Help Me Age to create Age UK. So it was the biggest older people's organisation, and we'd done some fantastic work. I was a head of department, sort of thinking about what I wanted to do next. And actually, I did want to work for an organisation where there was a kind of probably sort of singular focus, other than working on lots of different policy issues. And so this opportunity came up, and I guess I had been working on how we support older people and people with dementia from a kind of health and social care perspective. But it was very much on the kind of care and support side, rather than actually how do we understand this condition? What's causing it? How do we go about treating it? Like we would think about with heart disease or stroke or cancer. There wasn't really an organisation who was advocating for, trying to fix a system and trying to look after people better by thinking about how we could treat the disease that was leading to the situation where they needed care. And so I got to know Alzheimer's Research UK a little bit from my role with Age UK. And actually, this organisation, relatively small organisation, so I think that it was maybe sort of 35 people at the time, raising about 8-9 million pounds a year. So not sort of dissimilar to what my sort of probably entire department looked like at Age UK. Um, so it was a little bit of a leap of faith. They were looking for a new leadership team, so they're bringing 3 new directors. But for me, actually, this was a kind of an opportunity to go somewhere where essentially we were putting together a new strategy, thinking about actually how we really got dementia and dementia research kind of on the map. And that was sort of the brief, really, from my board of
Hmm.
trustees at the time. Um, so I guess for me, it was a challenge. I quite like a challenge. It was an ability to shape something and sort of hold something. Um, but it was very different. It was very different culturally, very different. But it was an organisation that had big ambitions, and some brilliant people, some really passionate people, and we're really starting to tell stories. So I think the government had just launched the Prime Minister's Dementia Challenge at the time. There was talk of a G7 on dementia research. A number of public figures had just started talking about their own Alzheimer's. So Terry Pratchett was one of them, and he donated $1 million to this organisation. So you could sort of see there was a bit of momentum. So it was right, okay, well,
Hmm.
how can we use that momentum, and what does that need to look like? And how can we start telling the real story as to what this condition
Hmm.
is? And I think my sort of lived experience of then the condition at that point, had been that people didn't really talk about it. There was still stigma attached. And I could see, the reality of how devastating it was, and the impact that had on my parents. And I think, that's the thing that hasn't left me. And yet, if you looked in the media at the time, you'd have a story about dementia, and it would be a picture of an older person's sort of wrinkly hands.
Hmm.
They didn't even want to show pictures of someone living with dementia, or even talk about the fact, I think we used the word, devastating
Hmm.
condition, or we talked for the first time in the press about this being leading cause of death. And even talking about that, actually, it was quite controversial at the time. Um, and it is the leading cause of death in the UK. And you will die with and from this condition, and it will take everything that made you you and your ability to function and live independently and be able to swallow and be doubly incontinent.
Hmm.
It's a horrible, horrible way to end your years and not know who your loved ones are. And so I think for me, that sense of injustice, and that we're not talking about this in the way that we are with other conditions. And I think, similar sort of time that my grandparents, probably just after they died, my dad had cancer, and he was quite poorly, but the way that people rallied around and supported and talked about it was markedly different. And
Hmm.
so I think the sort of juxtaposition of those conditions for me was really interesting, and seeing what, cancer charities have been able to do, and then thinking, well, look at Cancer Research UK. Why haven't we got an Alzheimer's Research UK that's sort of in it, on par? And they're still way above where we are in terms of their spending ability and the research that they fund. But actually, look at the trajectory of that condition that no one talked about. Couldn't even say the word cancer; it was a big C.
Hmm.
And actually, they started to change the tide in terms of stigma around a condition. So, how could this organisation do the same? So I very much came in to try and shape that message and the strategy of the organisation. So I was director of external affairs initially, and then sort of 18 months in, the board then asked me to step into the chief exec role.
And I didn't know until I was researching for this interview. I didn't know that it was a leading cause of death. I always assumed my dad also had cancer, and I always assumed it was cancer just because it's everywhere. It's talked
Yeah.
about so much. There's so much going on about it. And I think as I was reading more into it, and we have family members who are at some stage with this disease, I think the devastation is the right word, because even with my dad, in his last days, he still remembered, like, that he knew that we were there and we were with him, and I couldn't imagine, like, the impact it has on the family.
Mm.
There's the person that's going through it, which is awful, but we forget the family and the loved ones around. That every moment it's like, oh, it's forgotten a little bit, or they don't know what's going on, and that's just so. How does fast forward 10 years? What does the organization that you lead today look like as to when you first joined?
Yeah, so it's a bit different. It's a bit different. So I guess in terms of
It's a humble way to say it, Hilary.
yeah, in terms of, I guess, the stat. So we're now raising over 60 million a year.
Hmm. And it started at
And
10
we
when you, well, it
yeah,
started at 8 to 10 when you joined,
yeah,
which
just
is
less than that,
amazing.
yeah.
Yeah.
And then so we have sort of strong income growth, and obviously that means that we can spend more and more and more on our research portfolios. Um and then the organization itself, we employ over 300 people.
Mhm.
So I would say the organization when I started probably didn't have a sort of clear strategy or structure. So we're probably
Mhm.
on sort of the third sort of strategy phase that I've sort of overseen. So we have now a clear strategy of where we want to be over the next 10 years.
Mhm.
Um, and that's really exciting. I think the organization itself has never been clear in terms of what we're trying to deliver and what that world will look like for someone with dementia by sort of 2031.
Mhm.
Um, that's really exciting. That's really exciting. And I think the work that we've done in telling the story about the condition has made people sit up and think about dementia. Obviously, there's putting this organization on the map, but this
Mhm.
organization is there to deliver a charitable purpose, for us to be able to talk about and to be able to remove stigma and to be able to ensure that we're helping change the course of the trajectory of this
Mhm.
disease are the things that are really important. And that's really starting to shift. But these big societal changes is how we sort of deal with and think about and treat a health condition. They do take time. And I would say, it's now we're starting to think about, actually, this is what things could look like.
Mhm.
And a lot of that has been down to, work that we've done. But a lot of that, it's all about collaboration. And I think the probably way I have worked and tend to lead it's all about teamwork. It's all about people. And I think that, all the way from our kind of board down, that has very much been the kind of mantra of the organization. So we can't do it alone. Yes, it's brilliant that we've seen our income go up by that amount, but that's still a tiny drop in terms of, the
Mhm.
cost of dementia, the funding that's needed to make a real difference. So we have to work in partnership. We have to work with governments. We have to work with industry. We have to work with academia. And so Alzheimer's Research UK is very much positioned almost as a sort of glue between a lot of those different parts, and thinking about where are the gaps that research isn't being funded, where are the kind of hurdles that we need to be able to get over to get there faster and to deliver for
Hmm.
patients. So that's sort of very much been, of all of those sort of strategies and work that we've done, that has always been the basis, is around kind of people, around partnerships, and around having a really clear proposition of what research we want to fund.
What's been one of your hardest moments that you say, or the most challenging moments in the last 10 years? I'm sure there's many, but
There's
one that would
yeah,
like pop to mind.
yeah, there's a few. I mean, I think a lot of it, I don't mind a challenge. So, I think I'd probably do, I am someone who has got quite a bit of resilience. So, there's been different hurdles that we've had as an organisation. I mean, I think the pandemic for any organisation and for any charity was a big challenge. I mean, it was also a challenge. I had a 2-year-old and a 10-week-old. So my daughter was born in December 2019. And I thought, actually, with my second, right, I'm going to take a bit of maternity leave this time and sort of do things properly and have some nice time with the children. And I had a lot of time with the children in 2020. um, but that was tough because, trying to make calls in terms of, what we would be able to fund, what our income would look like, how we dealt with kind of workforce issues and furlough, all of those things. And so I probably lent back into it quite a bit. That year, which was tough because obviously I didn't have any childcare either.
Yeah.
So that was a different kind of challenge. I think then otherwise, it has been about, we've been an ambitious organisation, and it's an organisation where we've continually wanted to do everything. And so that comes with its challenges. And so actually the challenges have been, how do we prioritize? How do we say no to things? How do we just keep focusing on who we are and what we're here to do? Because there's always so much that we could do and we
Mhm.
want to be able to deliver. And so I think probably one of the kind of continual challenges has probably been that,
Mhm.
um, is always trying to put some of those constraints on ourselves and on the organization to keep that real focus, and to say no to things that actually sound brilliant, could deliver income, but actually that's not for us to be doing, or that's not the focus of this organization.
Mm.
So I think some of those have been sort of different challenges in different ways. And then I think, the other sort of challenge for us as an organization uh, is probably actually just, the ambition that we've got and that kind of continued growth. That's a continued challenge. This is not an organization that's ever quite in a sort of steady state. And in part, that's one of the things I love. I think it feels like I've had over 10 jobs in 10 years just being
Yeah.
chief exec, because it changes all the time in terms of what a role needs to be, what that looks like. And I think, the people at different bits of the organization feel quite similarly. And I think, that's fantastic. But that, that does have some of its challenges in terms of, ensuring that we can kind of keep up with the pace of ambition and continue then to be able to deliver. And I think the last few years have been really exciting, and the research has delivered. The clinical trials for the first time had positive readouts, but actually in the first 5, 6, 7 years, actually the research readouts from clinical trials of potential new drugs weren't positive. And that was tough because actually we were essentially positioning hope that we'll get there one day, but actually not this one, and actually this one didn't work. So actually getting people to continue to believe, no, actually research will
Mhm.
have the answer. We can treat this condition. This is a disease in the brain. This is what's happening in someone's brain with Alzheimer's disease. And the more research, the more we know about it, the quicker we will
Mhm.
get to treatments and solutions. And I think that, that has been something that if you haven't got the proof points, it's
Yeah.
hard to be able to show the impact of what you're doing as an organisation. That tide's changed massively. We have 2 licensed treatments available for early Alzheimer's disease. Unfortunately, not on the NHS yet, but still scientifically, we have that proof point, and we have a blood test. So that's, and I think something that you say, we will be able to be diagnosed by a blood test. That's a huge step forward. I think a little bit in terms of thinking about kind of HIV and AIDS or other conditions. Actually, if you can start to diagnose early, diagnose easily, um, and then there are some solutions and some treatments, actually that's the thing that
Mhm.
really probably challenges the stigma and some of those hurdles that we've seen historically.
Well, I mean, that was going to be one of my questions, but you sort of answered it about how do you balance. I always find with a research charity, because I work with so many charities across like my job, my actual job. I think with the research charities, how do you balance that ambition of, oh, we're going to find a cure, but then also science is slow. It takes time. Like there's so much nuance attached to it. Um, you spoke about blood tests and kind of the new drugs, and I'm assuming you're referring to like lecanemab as one of them as well. So just I guess from your perspective, how do people potentially living with this disease or knowing someone that's living with this, like how do they understand these developments? Because for me as a very like a novice, when I was obviously doing my research and it said that it reduces kind of the onset of Alzheimer's by about 25%. But we're not there yet. So if I was a family member or if I was affected by the disease myself, how do I understand that? Like, is this a turning point or is this the start?
Yeah. So I'd say, this is the start. It's the start in terms of the first licensed treatments that target the underlying cause of the disease. So this is for early Alzheimer's disease, and essentially, I mean, there are two drugs, lecanemab, Leqembi, and donanemab. They work in very similar ways, so they remove amyloid from the brain. They're
Hmm.
complex drugs in terms of how you would take the drug. So it's a little bit like having a chemotherapy suite for
Yeah.
Alzheimer's, in that it would be given intravenously, um, broadly every couple of weeks, every month for a period of time. So they're not perfect drugs. There are some side effects, um, but they are working on the underlying pathologies of the disease. We haven't had that before. Um, so that is a turning point in itself. And just like with any kind of first inline treatments for any disease, is it that itself is a starting point. So those, the drugs will get better, they'll be more
Hmm.
effective. But I think that actually, if I was to look at, my family members, and actually I've lost two. Well, I have two aunts who've had Alzheimer's disease. So my dad's sister died a couple of years ago with Alzheimer's disease, and my mum's sister's not well now. So I've seen it with essentially the next generation, and I think the sort of how I would look at it as to what this could look like in 10 years' time is,
Hmm.
you would have a blood test, and we would understand someone's risk of developing the disease. We'd have a blood test that can diagnose the disease. You then early on would have, one of these treatments that essentially is then removing or stopping the amyloid buildup in the brain. And then we can continually monitor people. That in itself is a treatment pathway that doesn't currently exist. That's a huge step forward. We're not we're not there yet, but what we are doing is building the capacity for more clinical trials in the UK. So actually, as more and more treatments start to come through, which they are, so there are 140 treatments for Alzheimer's disease in clinical trials currently, more than there ever have been before. So what we need to ensure is that the people in the UK have the opportunity to take part in those trials. So not only will they hopefully benefit from new, better treatments coming through, but our doctors have then more experience of delivering these treatments. Because so far, old age psychiatrists or neuroscientists who've been working on this, and neurologists, they, they haven't necessarily treated patients before. They diagnose them, and that diagnosis is often clunky, historically not always been correct, in
Hmm.
terms of the disease type. We are talking a number of different diseases that cause dementia. Um, so there's Alzheimer's disease, probably about 60% people with dementia might be Alzheimer's disease. We've got vascular dementia, dementia with Lewy bodies,
Hmm.
frontotemporal dementia, uh, and a number of other rarer dementias. And all of them will be diagnosed and treated in different ways. But we need to understand which disease someone might be living with, because actually then we can get better care and support for them. Because the symptoms from someone with frontotemporal dementia as opposed to Alzheimer's disease might be quite different, might present in quite different ways, might need different levels of support in different times. Um, so even today, actually just getting a early and a um, uh, proper diagnosis, that unlocks better
Okay.
support, better treatments, and then opportunities to take part in clinical research as that's happening. And then I hope in time we will get better, more effective, more cost-effective treatments that then will be available on the NHS. So I would
Okay.
say, in the next sort of 5 years, I think we'll see a big shift. In the next 10 years, a huge shift. That's not been enough for, the next generation in terms of my family. But for me, I sort of, thought of it in terms of, my next sort of 20, 30 years and what that looks like. So actually, 5 years time and I'm 50, would there be a blood test that would be available, essentially almost like a screening? We might not be far off that. How do I ensure that my children aren't going to be looking after me in the way that my cousins have had to look after their parents? And I hope I'm, not in that position with my parents who are in their 80s and thankfully very fit and healthy these days. But I think, that's sort of how we need to look at it, that actually, there are things that we're
Okay.
doing that will help people and ensure that we can get better support and care today. But actually, we need to ensure that the science that's delivering does deliver for patients and it doesn't take too long to get to patients. So there's a
Okay.
big piece of work to do from a health policy perspective with government. So I have a sort of another hat, which is to chair the government's sort of dementia task force in a sense. So after COVID, we obviously had the vaccine task force, and the government at the time then said, actually, why don't we take that approach with other conditions where we maybe haven't made the kind of impact
Mhm.
that we would want, or a big societal challenges. So there are dementia. There's a dementia goals program is its official title, but there's goals programs across a number of areas, including addiction and obesity and cancer. And each of them have actually got a bit of a focus to say, look, how do we work with industry? What are the big hurdles here in the UK in terms of getting these treatments to patients? How do we kind of join up parts of the ecosystem? So I sort of have sort of two hats in terms of ensuring that our health system starts to think about how we think differently when it comes to dementia medicines and what those pathway needs to look like, and what some of the infrastructure looks like. Alongside my Alzheimer's Research UK role.
Mhm. Um, it's a lot. It's good, and that makes sense.
Yeah.
I no, but it's a lot. Like, where do you fit all of this in?
I don't do a
I
lot else. I mean, I think
well,
people, I
I
sometimes do
think
see the interview and say, what are your hobbies? What hobbies? Um, there isn't, I mean, there isn't a lot of time for a lot else. I do, I try and keep fit. And I do a few things, but I do, I probably do spend quite a bit of time working. And if I'm not working, when I've got the children.
mm, your passion shines through, and that's what I meant when I said at the beginning about lived experiences. Like, this doesn't
Yeah.
feel like a job because it feels like
Yeah.
every little progress, and I can
Yeah.
imagine from your perspective, you're saying 5 to 10 years, but that's a short amount of time for kind of the
Yeah.
progress that
Yeah.
you're getting to. And my question was around, of course, the NHS, but that completely makes sense and how you've explained it. One of the things that you said earlier was just about collaboration and how this is something that we need to do together. And I know that obviously this is not just UK, but you guys work across Europe. So what is it that the UK, in your perspective, needs to do to better accelerate that progress? Like, how do we? So, for example, when the COVID vaccine came out within a year, which just
Mhm.
doesn't happen, like it takes decades for these things, what is it that needs to change? And if we start from our home country, what is it that needs to change in the UK and policy for us to work faster and quicker?
Yeah, big question. I mean, a lot of things I'd say would need to change. So I think from a UK perspective, I mean, one of the big hurdles has been investment in this. So actually, if we had 10 times or 50 times the kind of a level of investment, we would just get there quicker. No doubt about it. We can fund more science. We get more ideas, more shots on target in terms of potential treatments. Um, I think then the other hurdle has often been, and sort of true in terms of sort of vaccines, we do each bit separately. So we kind of do, we'll do some of the basic science and then we'll wait to see what works. And then we'll do the sort of translational science and then we'll sort of take it into sort of clinical trials. And then actually, if we can do some of that in parallel and actually let's see which bits of the system we can work in parallel, we can speed it up, we can align it. So one of the things we've done at Alzheimer's Research UK is set up 3 drug discovery institutes, one at UCL, one at Oxford, and one in Cambridge. And essentially, they have been set up to be kind of industry level standard drug discovery. So led by scientists who've worked in industry, who understand what we need to do to make medicines, what science is needed, what questions will be asked by industry or biotech or those coming in and investing, who are ultimately going to make the drugs. Rather than academia doing some of the research and then sort of waiting to industry to be interested. And then industry say, well, actually, I still need this, but we need to go back and do that experiment differently. So that's one of the ways that we're sort of saying, well, actually, how do we accelerate and how do we do that? Actually, in the UK, there's big opportunities. We probably have some of the best neuroscientists in the world. We have some of the best academic centres, and we have the health, National Health Service. So the data that we have, our patient data, is gold. It's
Yeah.
incredible. The kind of patient data, the kind of cohorts that we have. Over UK Biobank, we have our Future Health. We've got amazing patient data. If we can essentially make all of that data work and we can use it for understanding actually, what across our kind of life course will change in terms of, how people are at risk of some of these conditions. And that's the sort of programs that our Future Health are looking at. But then there are also actually, in terms of clinical research, actually for clinical trials, we should be one of the best places in the world to be doing this, but we're not necessarily. And some of that has been, it's quite clunky. There are different specialist centres. It's not necessarily all joined up. And so some of the work that the Dementia Goals Programme is doing and led by a brilliant professor at UCL, Kath Mummery, is essentially doing a new dementia trials network. And that's got £50 million of government funding, but actually new real leading centres that can be the best place for industry to come and run their clinical trials. So particularly for those early phase trials, those centres are going to be some of the best places to do that, and we can do that quickly, but we need then that pull through. There have also been challenges, I think, from a scientific perspective, is actually until we had the blood tests, getting the right people on the right clinical trials was really difficult, because actually you're essentially diagnosing people at the earliest stage of the disease, maybe before their symptoms are that great to come in on clinical trials, but we're trying to diagnose them through pen and paper tests. There are too many things that can go wrong in terms of doing that. So actually, a number of the trials that didn't work, you start to question, did we have the right people on those trials? Were we testing the drugs on the right people at the right times? And how were we knowing if they were really working? So there's a number of programs really to try and then join up parts of the system. So I think then it's about agility, and it's about kind of aligning resource in the right way. But ultimately, if you look at the overall cost of dementia on society, we're barely spending 1% of the cost of dementia on the research. So actually, if you tip that to be,
And by
sort of
cost, you
5%
mean,
overall,
by
the
cost,
societal
just so people
costs.
understand. Society,
Yeah,
so,
yeah,
care
yeah. So
homes,
the care
support,
costs, health costs,
medication.
yeah, yeah,
hmm
yeah.
And just for, I guess, a
Which
novice
is,
like me, when you talk about
we're
blood,
talking sort of 50 billion.
yeah, wow, okay, well, and for a novice like me, when you talk about blood tests, I assume these are the biomarkers that you're referring to,
Yeah.
and it's literally early screening for someone. Say for me, at the age of 35, I go and I get a blood test, and it says you may have the potential to develop Alzheimer's or a form of dementia. So where are we in that journey of me going to be able to go and get a blood test if I had, concern that I could potentially develop it?
Yeah, so I guess there's two different parts to this. So one is around blood test and biomarkers for the use as a diagnostic tool. So that
hmm
would be people with early Alzheimer's disease. So that wouldn't be someone, at yours or my stage of
Yeah.
life. This will be generally older people, not always. And we'd be using this, if someone is coming through to a memory clinic, they've got concerns about their cognition, and we're using that as a diagnostic tool. That is sort of where we are. And we have got a number of programs that are working to look at how you could integrate that into clinical practice in the UK. So in terms of kind of an understanding of how you would use a simple blood test as a diagnostic tool, that's sort of where we are. And it is starting to be routinely used within the NHS
Oh,
in
amazing.
pockets of the UK. When it comes to then a kind of a screening tool, that's slightly different. So in terms of then showing people's sort of risk profile, there's a number of ways of doing that. So actually there's genetic risk, there's then understanding, who has a higher risk of developing this. There are blood tests looking at, the levels of amyloid load And so, amyloid is one of the is essentially a toxic protein that builds up in the brain. People who've got often got dementia, but there are also people who have higher levels of amyloid load that don't necessarily go on to develop dementia. So there are still scientific questions and things that we need to unpick and understand.
Hmm.
So it's important that we would use these blood tests in the right way. But you can imagine a world where actually we do get to the point where actually we've got blood tests that are accurate enough to be able to use as a diagnostic, but also as kind of an early detection tool. So there's also programs of work looking at what that would look like. So we know there are
Hmm.
particular genes involved, but some of those genes might just mean you've got a high risk. It's a very small number of people
Hmm.
who carry genes, which means they will certainly go on to develop, and that's often with some of the rarer dementias than the early onsets. Um, but a number of those people who, sadly do carry that gene within their families, often that's people in their 40s and 50s.
Okay.
Um, uh, and a number of those families are involved in research and have really unlocked the key to our understanding of the condition, because actually if we know that we know with certainty that some of those people, if they carry the gene, they will develop dementia by 50. So actually, if they're involved in some of this research, actually, this is where some of these original drugs, these anti-amyloid drugs, the research came from families, and one particular family actually, who saw a real pattern in their own family of people developing dementia by the time they were 45, and came forward to be part of that research. And actually, what that showed is all of those people had this high amyloid load, and so that's where the sort of amyloid
Wow.
hypothesis essentially came from. And that was a scientist who's now the vice president of this organisation, a scientist at Sir John Hardy at UCL.
Wow.
So I think that this is where the people and their experience and coming forward and being part of clinical trials, that's what unlocks that progress.
Wow. It literally, it feels like a lot of your team is like part of that lived experience kind of, demographic. But wow, it's amazing. And actually, that brings me really nicely onto the Dementia Unseen campaign. So can you just talk me through a little bit about what inspired that campaign that's,
Yeah,
just
yeah.
been running?
Yeah, so Dementia Unseen really is about trying to ensure that people get a timely diagnosis for their dementia. So that campaign really has come out of, again, talking to people with lived experience who just didn't feel that they were seen or heard. We know there are long waits to often see a doctor in a memory clinic. So you might go to your GP with some concerns, and often it takes a while for someone to come forward and go to their GP or a family member to talk to their loved one and say, like, I'm a bit worried about your cognition or your memory. That's a big
Mm.
thing in itself. And then to get to your GP and then get to see um, a doctor in a memory clinic. And so to really try and, I guess, again, give voice and profile to those who are going through this at the moment and saying, actually, people deserve a diagnosis quickly, ideally in 18 weeks, just like you
Hmm.
would heart disease, stroke, cancer. There's no reason why dementia shouldn't be treated the same. And I think the diagnosis itself does then, it often, as devastating as it can be, gives people some sort of peace of mind in terms of an understanding of what's happening, either with themselves or with their loved ones. And it unlocks care and support and social care and financial support and all sorts of things that actually they have a right, rather than struggling to understand what is happening and waiting for often too long a period of time to get that diagnosis. And obviously at the moment, the diagnosis, if as we've touched on, is likely to transform in the next few years. But actually we need to be in a position where we're saying to everyone, you should have a right to be diagnosed and supported. But it's also not just about that diagnosis. It's then about that support that people are given after that, and the ability to be involved in clinical trials early enough. Because if you're not diagnosed early enough, you won't have the opportunity to be involved in trials. And actually in the future, these treatments, a little bit like if you're talking about cancer and you picked up cancer at stage 1 or 2, there'll be all sorts of treatments available to you where you can live better with that cancer, or we can cure that cancer. If you're diagnosed at stage 4, the likelihood of us curing your cancer or treating it effectively is slimmer and slimmer, and your quality of life is much poorer. And it'll be
Hmm.
the same with with dementias. So actually, that's why we need to diagnose earlier. That's why people need to be seen and they need to be heard. So we've been running a petition which has been calling on government to bring dementia within the 18-week target, but also really say, dementia diagnosis has to be a priority, and therefore the 10-year health plan and modern service frameworks that are being talked about within Department of Health and Social Care at the moment as to what that will look like and what the ambitions are for that strategy really need to have people with dementia at the heart of it.
And with the people behind this campaign, I was reading through it. Is there any story that's really stayed with you?
Number of stories, and it's always wonderful when people will step up and talk to us about what they've experienced within their family or what they've experienced themselves. And I think the heartbreak often in so many families who haven't had a diagnosis at the right time or have really struggled, and that's the majority of the people we hear from. But actually, some of those stories and individuals who have had a timely diagnosis, have had the right support, have then wanted to be part of research or wanted to be able to get involved with what we're doing as an organisation. So have come to us wanting information about dementia research, who signed up to be part. We run something called Join Dementia Research, so really easy way just to sign up to be part of clinical trials. That actually gives people hope and feel like they're doing something for their loved ones, for the next generation, for society, and that they're doing something positive by lending their voice to it. So I think there's always a number of really inspiring case studies, which is really heartening to see.
It's wonderful. I think it's one of those things that probably also keeps you going. What do you think has been one of your key lessons in the last decade, leading something that's not black and white and that's very like, today we're doing this, tomorrow we're doing something else. We don't know what we're doing next month. Almost.
Yeah, I think probably having having a clear plan is absolutely key. Being comfortable with flexibility about how you deliver that sort of strategy and plan at any one point, and having the sort of I guess I probably have had to sort of draw on sometimes a sort of inner confidence to say, this, but we're doing this for the right reasons. We are doing this, you know, we are ambitious, not just as an organization or as an individual. We're ambitious for what we need to see for people with dementia. And therefore, this is why we need to persevere. This is why that I've got to just hold on tight and actually kind of believe in what we're doing. And, touch wood, this far, we've been okay. And actually year on year, we've managed to deliver what we said we're going to deliver. We've, smashed targets from a kind of income and the work that we've done from various different, research projects. But, there are sometimes things that don't necessarily work. And I think you also have to be really bold about saying, well, actually, that's not quite working the way that we want it to. So we're not going to do that one anymore. And we're going to be really clear about why we're not doing something. And probably my role more and more these days is to sort of say, actually, tell me what we're not going to do and tell me where we're going to focus. How do we prioritize? Because as we grow, as I said before, there are so many different opportunities. So how do we then kind of keep pulling that in? And so I think, again, that kind of has to continue to draw on that real focus. And the reason I came here was to have that kind of singular focus and an organization that had that absolute kind of clear laser-like focus. And so remind myself of no, this is who we are and this is what we're here to do. And therefore, so if something that's a great opportunity doesn't fit, I'm comfortable with that, and that's the right decision.
And as we come to a close, and when you think about like the next decade with your 10-year strategy coming in and things changing, what do you see? What do you see life looking like for the charity, so AI UK, but then also for yourself?
I think the next 10 years is hugely exciting, and actually, what a world in which we are, detecting, diagnosing, and starting to treat the majority of people within the health service is a very different world, and that's fantastic. We will need this organisation, as a society more and more, because there are still some huge questions that are unanswered from a scientific perspective. We have 2 licensed treatments. That's all we have, and we're talking about so many different diseases that cause dementia. We need a whole array of different treatments that will treat those different diseases at different times for different populations. So there's so much more that we all need to do. And I think that, once you start to have people who, essentially you're survivors who are the first people who've had treatments who are saying, actually, I've been on this treatment for 5 years and, my cognition hasn't got any worse and I'm still able to do things with my grandchildren. I can follow knitting patterns. And there's one woman I've met who's been on a trial for 7 years and who's taken one of these drugs and saying, actually, you can see from her brain scans, actually, the brain shrinkage hasn't got any worse. Actually, her cognition's, not declined as much as we thought it would be for someone who's got Alzheimer's disease in their 70s, and she's still able to follow knitting patterns. So, for me, thinking about what that then looks like, we need to ensure that, that health systems are ready and prepared, that we've got the next generation of drugs that are even better, that are more effective. But in order to do that, there's going to be a big piece of work over the next sort of 5 years to get there. And people are going to want to know more about them. So our kind of role in terms of kind of advocating and information is going to be really key. But you look at where Cancer Research UK are and, how successful we are in treating lots of cancers. But there's some still, big unknown challenges in cancer research. And you look how successful, cancer research field has probably been for the last 20, 30 years. And I think there's been some work sort of looking at dementia now and saying actually dementia is where cancer was in 1992. So,
Oh,
actually thinking about, where we would get to in the next sort of 10, 20, 30 years. So, yeah, really interesting, I think, then thinking about what that means for us as an organisation. And that's a lot of the work that we've been doing. And then, for me personally, I think this sort of feels like now I've got the organisation that I can maybe do some of the things that I wanted to do when I first came in, because it takes a long time to build organisations. We didn't have a lot of the functions that you would expect organisations to have. We didn't have a finance team. We didn't have a policy team. We had an accountant. And it was a really small lean team. But we now have, I think, the infrastructure and the organisation, and people are starting to get to know us and see us and support us, which is fantastic. And we really need the public to get behind us as an organisation. So, I think I've certainly got my work cut out for the next 10 years. And then I will be in the position of having 3 teenagers. So we'll see how that goes.
no more babies at conferences then.
No, very
You take your
different
then
challenge. I know. Yeah,
18-year-old,
yeah,
in case you run
exactly.
into the same security guard again.
Yeah.
Oh, it's brilliant. So before we end, I always do like a quick fire round with my guests so we can end on a bit of a high. So it'll be a series of a couple of questions. Don't think too much. They're quite fun. Nothing too serious. Ready?
Go on.
Yeah, right. Early bird or night owl?
I'm somewhere between the two, actually. 10 years ago, I was
How
definitely
with
a night
kids?
owl. And they, yeah. My eldest
I'm a
does
night
know
owl,
mine,
but
but the
I
other
don't
two
have
know.
a. Yeah, I'm on definitely a
They
night
don't
owl,
let
but
me.
my son doesn't let me. Yeah, exactly. Like
Yeah, yeah,
involuntarily early
yeah.
bird. Coffee or tea?
Coffee.
Data or instinct?
Naturally instinct, but I increasingly data led, but there's
Yeah.
always, you've got to have a bit of instinct.
Emails or walking meetings?
Ooh, walking meetings.
Power suit or trainers and jeans?
Power suit. Love a power suit. Nice bright colour.
What's your go-to way to reset after a long day?
Um, Probably a bath.
And if you weren't leading AR UK at the moment, what do you think you'd be doing?
If I was doing something completely different, I would love to be doing something outside.
Okay.
So
Uh,
I'm still quite outdoorsy. I love being outside. I like getting messy. If I get time in the garden, that's kind of my happy place, to be kind of outside somewhere wild and messy. And
yeah.
so yeah.
Who's someone that inspires you right now?
Yeah, good one. I think there's quite a few different people that inspire me in different ways, actually. So I'd say, um, my mum and my aunt have been huge inspirations in terms of kind of what they've achieved and their kind of life story, which is probably a whole another podcast in itself. But amazing kind of powerhouses of women who came from nothing and achieved a huge amount. Um, and then I think then there's some of the scientists actually. I think probably some of the most inspiring people that I work with. Um, a number of them not dissimilar age to myself, kind of, been professors at the age of 40, have
Wow.
found, new mechanisms uh, in, working in dementia, so often sort of neuroscientists and cell biologists. And I find them hugely inspirational in terms of, the work that they're doing in the lab and their day-to-day work. And that, I think that's what sort of makes this organization and drives us on. But I think, it's those scientists that are the real heroes.
And last ones, if your younger self could see you right now, what do you think she'd say?
I think she'd be amazed.
Yeah.
I
Go
think,
on.
I was, I was quite shy at school. I would have hated standing
Oh,
up in front of lots of people, and I do it almost on a daily basis, kind of getting up and doing big speeches or media interviews or podcasts, whatever it might be. And I really enjoy it. I'm quite comfortable doing it now. It's always a bit nerve-wracking doing some of these things, but I think, I think a kind of younger self would I hope would sort of be impressed, but also I think it just shows, the kind of 13-year-old schoolgirl could go on to do something I would have never thought would have been. I never thought I'd get to university. Then I'm forever thinking I can't do something. I was first generation to get to university. That wasn't a sort of given. Um, but yeah, so I think
it's
I'd be
amazing.
proud and impressed. Hopefully.
Oh, amazing. Hilary, it's been such an honor to speak to you. Thank you so much for
Oh,
making the
thank
time.
you. It's
And
been
also,
great.
thank you for explaining something that's usually quite complex and kind of, usually goes over my head. But you've explained it so simply, and just the message and your passion really comes through. Like, it really shows why you're doing what you're doing. Like, I think if I speak to you, hopefully in 10 years' time, you'll still be there. We can do like a re-record in about 10 years' time. But thank you so much. That was wonderful.
Pleasure. Lovely to see
Thanks
you.
so
Thank
much.
you.